I'm a registered dietitian.
I'm an exercise physiologist.
I'm a cardiologist.
I'm a clinical pharmacy coordinator.
I'm living with heart disease every day.
And I live with coronary artery disease.
It's sobering that approximately 30% of patients with heart disease may suffer from anxiety, and nearly 1 in 3 women who have heart disease will suffer depression. In fact, more women suffer depression than men with heart disease. In persons with heart disease who have anxiety and depression, studies have shown that they experience more symptoms, more heart symptoms, and they may have poorer functioning during recovery and poorer quality of life outcomes. Therefore, the experience of anxiety and depression are important to consider for women with heart disease as they are recovering from events such as a heart attack, from heart surgery, or from stents. I'm joined here today by Dr. Elaine Darst, who is a professor at the University of Minnesota and an expert in psychological care. Dr. Darst, how might women recognize the experience of anxiety and depression?
Well, a good way to think about this is to think about your mind and thinking, your heart or your emotions, and your body functioning. In depression, the body slows down, appetite may be decreased, a person could lose weight without intending to, and the sleep can be disturbed. The thinking may get negative. There can be feelings of worthlessness and hopelessness and not being able to think about a positive future. And if these kinds of things persist over a period of 2 weeks, including things like suicidal thoughts, then it's important to get some help. In anxiety, a person might feel more agitation, and anxiousness, restlessness, heart rate might be increased. So there again are physical changes. The mind might be more hazy, fuzzy, unable to focus, unable to make decisions. And of course there are fears with anxiety, fears of not being able to survive, for example.
Well, wouldn't one consider that kind of response normal if you've just had a heart attack?
Well, yes, actually, because there is a crisis at that point, and in a crisis people will feel anxious, they will feel depressed. And I think it's important to know that it's okay to get help during that time if a person chooses to, but they don't have to from a mental health professional. The thing that makes something a disorder is the length of time it lasts, the level of functioning. If a person's able to eventually, in a week or so, a couple of weeks, return to their usual level of functioning, perform okay at work, with maybe minor interference, or at home and in their relationships, that's very important. Length of time and ability to function.
So what should women do if they experience these symptoms, if they're interfering with their quality of life or daily functioning, or if they persist?
I think the first thing to do in any crisis is to seek the help of your family and of your friends, your loved ones. Talk to your family physician. Employee assistance is another place to check into. Insurance companies that you're connected to, they usually have lists of providers. And also the faith community can provide assistance with that. Then also a support group. Of course, if you're in a support group already, that's really important because those other people will have suggestions on who you might consult with. You know, organizations too, like the National Alliance for the Mentally Ill, are possible. There is a suicide hotline that's a national hotline. So when people are having that serious of a situation, then they really do need to get immediate help. They can call, or they can go to a hospital emergency room and get assistance. And that's pretty important if somebody's planning suicide or feels like they're going to act on a suicidal thought.
Yes. Anxiety and depression are common in persons with heart disease, and the experience of symptoms is important and should not be ignored. Returning to normal daily routines and activities, including exercise and an active social life, are important. Cardiac support groups, talking with other women and the experts leading them, are often helpful in recovery. Women should not hesitate to seek help if the level of symptoms is high or if they persist, since anxiety and depression may impede full recovery. Dr. Darst, thank you for being with us today.
And thank you.
My name is Ruth Lindquist. I'm a professor of nursing at the University of Minnesota.